Hello everyone, today we are going to talk about brachial plexus injuries. There are two types of brachial plexus injuries as Erb's palsy and Klumpke's palsy. First, we will have a look on Erb's palsy. You have to know what are the causes for Erb's palsy. Mostly in the forceps delivery, it can cause Erb's palsy. Erb's palsy means the upper lesion of the brachial plexus. It means it damage to C5 and C6 nerve roots of the brachial plexus. Here you can see the presentation of Erb's palsy. We call this presentation or deformity as Vater's tip or Porter's tip deformity. Here in this lesion, due to the damaging the nerve root C5 and C6, there are several nerves which supplied by C5 and C6 nerve roots are become functionless. Those nerves are suprascapular nerve, nerve to subclavius, musculocutaneous nerve, and axillary nerve. Therefore, the muscles which is supplied by those nerves may paralyze, and the action which is done by those muscles are weakened or lost. Suprascapular nerve supplies supraspinatus and infraspinatus muscles. Supraspinatus and infraspinatus muscles, nerve to subclavius muscle supply, subclavius muscle, musculocutaneous nerve supply, coracobrachialis, biceps brachii and brachialis muscles. Then axillary nerve supplies deltoid muscle and teres minor muscle. Therefore, all these muscles are paralyzed in this lesion. Supraspinatus muscle initiate the abduction of the arm at the shoulder joint. It initiate our abduction of the arm. It means from 0 to 15 degrees. Abduction is then preceded by the muscle fibers of deltoid until the arm is abducted to a right angle. It means from the 15 degrees to 90 degrees abduction is done by the deltoid muscle. Therefore, the upper lesions of brachial plexus, this abduction of the arm of the shoulder joint is impossible because the initiation of the abduction is lost. Those patients cannot abduct their shoulder joint. Also, there is subclavius muscle damage, therefore there is depression of the clavicle. And also, coracobrachialis muscle is functionless. Also, infraspinatus and teres minor muscles are damaged. Infraspinatus muscle and teres minor muscles are responsible for the lateral rotation of the shoulder joint. Therefore, when these muscles are paralyzed, lateral rotation of the shoulder joint is impossible. So, the arm is medially rotated by the unopposed action of the pectoralis major muscle. Here from this arm is medially rotated because those patients cannot do lateral rotation of the shoulder joint. Those patients cannot do abduction, therefore the arm is adducted. Therefore, the arm is adducted by the part of pectoralis major muscle. Biceps brachii and brachialis are the flexors of the elbow joint. So, when they are paralyzed, those patients cannot do the elbow flexion. Therefore, the elbow is extended. Due to paralysis of the biceps brachii muscle, the arm is pronated. Forearm is pronated. You can see here, forearm is pronated because those patients cannot do their supination. The major muscle that is responsible for supination is biceps brachii. Although there is supinator muscle intact, those patients cannot do supination action. So, those are the deformities of the Erb's palsy. Next, we will move on to Klumpke's palsy. Klumpke's palsy occurs due to upward traction on the arm. Example, in a breech forcible delivery, it can tear lowest root. It means T1 nerve root can be damaged, and it is the segmental supply of the intrinsic muscle. Here you can see there are two pictures. Here upward traction of the arm. Here also there is upward traction of the arm. These two causes are the causes for the Klumpke's palsy. Here you can see there is cloud appearance in the hand due to Klumpke's palsy because T1 nerve is the nerve supply for the intrinsic muscles of the hand. Because of the unopposed action of the long flexors and extensors of the fingers, the extensors inserting into the base of the proximal phalanges extend the metacarpophalangeal joint, as here, while the flexor digitorum profundus and flexor digitorum superficialis muscles which are inserted into distal and middle phalanges flex the interphalangeal joints. Here you can see flexion of the hyperflexion of the interphalangeal joints and hyperextension of the metacarpophalangeal joint. This is called as claw appearance, which is caused by Klumpke's palsy. Also, there is a sensory loss due to this injury in the medial aspect of the arm. It is in the medial aspect of the forearm as well as hand. So that's all about Klumpke's palsy and Erb's palsy. I'll show you a comparison of Erb's palsy and Klumpke's palsy. In this picture, you can see here this is Erb's palsy and this is Klumpke's palsy. Erb's palsy, there is damage to C5 and C6 nerve roots. In Klumpke's palsy, T1 nerve root is damaged, lower trunk injury. Here in Erb's palsy, the deformity is called as waiter's tip posture. You have to remember this appearance, then you can easily work out the deformities caused by damaging of the particular muscles. Here in Klumpke's palsy, the deformity is called as the claw hand deformity. It means extension, hyperextension of metacarpophalangeal joints and hyperflexion of interphalangeal joints. So that's all about brachial plexus injuries. Thank you for watching.